Welcome to Living Healthy with COPD. Subscribe and hit the notification bell. A recent documentary film shines light on physical and emotional impact of COPD. The film is called Clear the Air and it profiles stories of people living with the challenges of COPD, a chronic, life-threatening disease that affects millions of Americans. Emmy-nominated director Abby Levine inspired to create film following her own mother's COPD diagnosis.
One, two, three. Kathy and I used to play in bars, clubs, hotels, fairs. Any place that we could play, we would play. We had a good time. They gave him his orders from Monroe.
We made sort of a living. How did it was we didn't get rich.
Scalded to death by the steam. Gonna pick a little bit. I have the energy to play, not like I did years ago when you would play 4 or 5 hours a night, but now I play when take a break and the bars are all smokeless and all that kind of stuff, so I don't have any problem. All you young ladies, you had better take a warning. Don't you speak harsh words to your true loving husband. He might leave you and never return. When you're young, you never think about getting something like COPD, and you say, wow, how did this happen to me?
COPD stands for chronic obstructive pulmonary disease. COPD is a progressive lung disease, and the net result of that is largely shortness of breath, coughing and wheezing, and pressure inside the chest are also common symptoms. It's still a very leading cause of death in the United States and worldwide. It's not a curable disease.
I want you to take heed to that song, those lyrics, that last verse, right? Like, you got to pay attention to what was being said there.
I did.
Kathy and I used to play in a band called Hard Living, but now it's just her and I on the drum machine, and we call ourselves Geezer and Gazette.
Growing up, I was shy. I had friends, but I was kind of timid, and I just stayed in the background. And I took some piano when I was in high school. I think that really helped me to have more confidence and get over some of that shy feeling. And I've recently picked it up. I decided I wanted to have something else to fill my time during the day. I needed some lessons because I had gotten rusty and I needed to have somebody give me some guidance.
Hello.
Hi, Linda, it's Tina.
Hi, Tina. How things going?
Good, how are you?
Oh, we're doing fine.
When I met Tina a long time ago, she was quite short of breath. She was not able to do her daily routine, and now she's actually has gotten much better. She's going back and taking her piano lessons. Other than medications, Tina's treatment plan also included healthy habits, appropriate diet, and oxygen therapy.
Well, I think we're set up for piano tomorrow at 4.
Yeah, 4 o'clock at work.
Okay.
That's fine.
Okay, I'll see you tomorrow.
Okay, thanks.
Bye-bye.
My name is Mary Savord, and I live in Hermansville, Michigan. That's the UP, and so we live here, so we're Upers.
So how have you been feeling?
I'm doing pretty good. I'm holding my own. Shannon's a friend of mine. She comes over and helps me out every once in a while. When I was about in 3rd grade, all of us used to smoke cigarettes. I even learned how to inhale. It was very relaxing to me.
20 to 30% of smokers will develop COPD.
I really can't even stand the smell of cigarettes or can't stand to even be around them.
COPD does affect the airflow when people are trying to breathe, and that causes respiratory symptoms. Once you have it, you always have it. I think most people associate it with current or past tobacco smoking. It can also be associated with other exposures, though.
I was a very heavy smoker, lots of cigarettes. If I ran out, it didn't matter what time of the night it was. I went out and got more.
Some people don't have empathy for COPD patients, but there are also COPD patients that have a hard time giving themselves a break. And I see that as an opportunity to help them not be so hard on themselves. It's important to realize that everybody's just a human being.
The other day I was at pulmonary rehab.
Oh, okay.
Yeah, they've got all kinds of really good machines there. They monitor while you're on the machines.
Mm-hmm.
I've made a lot of progress so far.
Oh, awesome. Do they put you on a running machine?
Yeah.
Oh, what if you can't run very good?
Well, you know, you can speed it up or slow it down.
Okay.
Dr. Jackson's office is like him walking in the front of somebody's home. You got a sign outside that says, "Take your shoes off." This is Hawaii.
I met Bob about a year ago, and he has just been a joy to work with. He's got a tremendous, warm personality, and he's someone that everybody loves as soon as they meet him. Mr. Moss, good afternoon.
Good to see ya.
Thanks for coming in to see me again,
Well, thank
sir.
you.
Now, how have you been since I last saw you?
I've been real good. Real good.
Glad.
Good.
I'm glad.
I got COPD from breathing chemicals, worked as an aircraft mechanic. I worked on the flight deck of aircraft carriers doing landing and takeoffs, inspections, and it wasn't from smoking like a lot of people get it.
Do you feel like you're able to do your activities?
Yes, sir. I've been get outside and work in the yard a little bit. I've been working my wood shop a little bit, play a little music a little bit.
And what limits you in your daily activities now?
Old age.
I don't have a cure for that.
Yeah, breathing's not bad. You know, I've just learned to take when you recognize the feeling and you just stop for a minute and recuperate and continue on.
That's perfect.
It works out really good.
That is perfect.
My relationship with Dr. Jackson is very, very friendly.
When I first met Bob, he had very compromised lungs.
I was hospitalized for pneumonia for about 10 days, and then I had like 6 weeks of physical therapy when I come out just to be able to get around normally. Just imagine if you could sit there and you could do absolutely nothing, how a person would feel.
Any questions you have for me today?
Not really. I can't think of anything other than, where's the champagne?
Tina and I get along really well.
These are only winter?
Yeah, only winter.
Do you remember when Mama got a whole collard and she brought it home and put it in the washing machine?
Yeah, it was like this big.
And tried to
it was
wash
like
it?
a cow or something.
Tina and I grew up in a cloud of smoke, essentially. Mom and Dad smoked indoors, outdoors, in the car.
I've never actually smoked. I ended up marrying a smoker, and he smoked 2 packs a day, and we were married for several years.
Stop complaining.
I'm not. I'm just telling you what I would do.
You want to eat these or not?
I'm going to eat these.
Tina is my last surviving direct family member. We lost my sister in 2009, my father in 2004, my mom in 2010.
One thing I'm really happy about is how much better you seem to be doing. You know, it's not even a year ago, I don't think we could have done this.
Sometimes I didn't realize I've improved as much as I have, but people keep telling me that, so I think some of this medicine is really making a difference.
You just seem so, I don't know, it's not just healthier, but you're happier. I noticed that Tina is breathing better. She's not coughing as much.
You know, I'm taking the piano lessons now.
Tina is not necessarily musically inclined. I think she's fighting to make herself better at the piano, but she is certainly determined. And the more determined she is, the better she gets at something.
It makes me feel like I'm accomplishing something.
I've never been overly optimistic, but I'm somewhat optimistic, I guess you could say, because I do enjoy living. That's for sure. You know, there's a lot of people with physical challenges, and I'm one of them, and mine happens to be COPD. If I had it to do over again, I wouldn't have smoked, of course, but I managed to get through life all right.
When you look at Mary, you can't tell that she has COPD because of how proactive she is. She's learned how to live with it.
I should tell you I'm 76 years old. I live by myself, And sometimes I do have some challenges in my daily life, I guess. For the most part, I get along just fine. I've learned how to adapt, that's for sure. I usually grocery shop once a week, maybe once every 10 days. My diet consists mainly of fruits and vegetables. At this stage of my life, it's important to me to be able to do my weekly errands by myself. I hope to keep doing it for as long as possible because I know that COPD is a progressive disease.
Total is 5634.
I'm managing to hang in there and keep it an even keel right now and without losing ground. I want to live the best life I can right now, and I really want to stay independent.
Before I go to my piano lessons, I make sure I don't make any appointments so that I can be rested. And of course, I try to practice. I want to have enough energy to be able to go and enjoy it and make sure I don't have any problems getting there. I take lessons once a week.
Some days, if she's not feeling that well, then she postpones her lesson. But most of the time, she is here now.
Bye, Sassy.
Because it helps her. It gives her something, I think, to look forward to. When you play music, you need to play it for you, how you like it. I like that part.
Linda says I play piano well, but sometimes I question that. I had a lot of wrong notes, but you know, it's fun. That's all. That's the only thing I want to do is have fun with it. I'm glad I made the decision to give back to it because it's really making me happy.
My wood shop is a hobby for me. I like to make Hawaiian steel guitars. It's just a little sanding and a little something with a saw. I like working with my hands a lot, very satisfying. The biggest thing about woodworking is to be patient, not try to rush things. It will come out if you take your time. It's not any big deal, it's just really fun. It's something I just like to do.
Bob's guitar making skills, well, he couldn't do it before, so now he's good at it.
I wear a mask because you don't want to take any kind of particulates in with it when you got COPD. I always take that precaution to keep myself from inhaling anything that is detrimental to my breathing. There was a time I could do any kind of a wood project, very minimal time.
Being out of breath takes your energy away from you, you know.
It's nice to see you taking advantage of the gym and whatnot.
Oh yeah, I wish I had one of these at home.
Yeah, right. They've got some nice equipment in here. Obviously, breathing is a basic function of human beings. We don't concern ourselves with it unless we have an upper respiratory cold. And still making it out in the winter for your pulmonary support groups?
Oh yeah, whenever I can. I mean, sometimes I don't make it, but
that's what I love about you. Yeah, you're very dedicated to that, so that's great. My grandmother had asthma, and I actually had some childhood asthma myself, so I guess that kind of drew me into pulmonary medicine. But it's just a very rewarding field in general. There's nothing like somebody coming in for their second visit with a big smile on their face because they can breathe better, and it makes me smile too. So it's a very important part of your COPD kind of treatment plan, and everyone likes to see you there.
I've learned a lot from that group.
And you teach them a lot, I'm sure.
Well, I don't know about that, but with COPD, it's not really hard to get the air in. I have to be able to get it out before I can get the oxygen in. In day-to-day living, I do okay. The cold air is sometimes pretty bad. I use something over my nose and mouth.
Working with Mary to develop her COPD treatment plan has been fun, actually. Mary comes in with her own suggestions, and in fact, she suggested to me trying Stiolto Respimat, and she loves it. Stiolto Respimat starts opening airways within just 5 minutes and lasts a full 24 hours. It's not for the relief of sudden COPD symptoms, and patients should always carry an emergency rescue inhaler.
Adding Stiolto to my treatment plan helped me to breathe better. I noticed when I was grocery shopping that my symptoms, such as coughing and wheezing, didn't bother me as much.
People with asthma who take long-acting beta-2 agonist medicines, such as Olodaterol, one of the medicines in Stiolto, have an increased risk of death from asthma. Stiolto should not be used to treat asthma and should not be used for treating sudden symptoms of COPD. People should not use Stiolto if they are allergic to tiotropium, ipratropium, Olodaterol, or any ingredient in Stiolto. As with other inhaled medications, Stiolto can cause serious side effects, including sudden shortness of breath that may be life-threatening. The most common side effects are runny nose, cough, and back pain. I think there are a lot of benefits of Stiolto Respimat inhaler. I really like the slow-moving mist.
Stiolto Respimat is a slow-moving mist, and I really like the way it delivers. And I would say that it's easy to use.
I've talked to Dr. Jackson before about fishing, and today we're going to finally go do it.
Hi, Bob. I made it.
Yeah, we're fishing for the big ones.
The big ones? Okay.
The big ones.
Big ones like 6 inches?
6 inches.
All right, I'll take it. My catch will be your bait. How does that sound?
Dr. Jackson takes his job very seriously, but he can still be lighthearted with you and talking. He's funny.
You over here chumming the waters?
Yeah, I'm fixing your pull up right now. Yeah.
So what do we got here, little squid?
I found Stiolto by researching the web. I read that it was 2 different medications that had never been put together before. Since I am more prone to pneumonia, it was important for me to find a medication that was steroid-free. That's why it made me inquire about it. Squid. We're going to throw that out there and see what bites on.
I like the strategy. What do you catch in here?
Perch, papillo.
How long till we get a bite?
It may take hours. I have noticed such improvement in my breathing. It's pertinent ridiculous. You wouldn't think that something could make that much of a difference in you, and it does.
My life is dictated by my COPD, but I don't let it dictate my life. Dr. Ravel's treatment plan for me has helped me because he's introduced different medications into my life at certain times.
I empower my patients to take care of their own health by educating them and playing a very active role into their own health. Tina has been a very active participant of a respiratory support group that we have at the hospital over here. She takes great pride and a very active leadership role in order to try to educate new people that are coming in.
I enjoy watching Tina play the piano because it's something I didn't know she would ever do.
I want another patient with COPD to know that just because you have COPD, don't let anything hold you back. Just keep going and don't let it stop you.
I hope that she continues to improve all the way around.
I'll go with my family to the beach in a few months. And I just want to put my toes in the sand, and that's going to be so spectacular. I mean, it's just going to be wonderful.
Important safety information for Stiolto Respimat, tiotropium bromide, and olodaterol inhalation spray. People with asthma who take long-acting beta-2 agonist LABA medicines, such as olodaterol, one of the medicines in Stiolto, have an increased risk of death from asthma problems. It is not known if LABA medicines, such as olodaterol, one of the medicines in Stiolto, increase the risk of death in people with COPD. Stiolto has been approved for chronic obstructive pulmonary disease, COPD, only. Stiolto is not to be used in asthma. Do not use Stiolto if you are allergic to tiotropium, ipratropium, atropine, or similar drugs, olodaterol, or any ingredient in Stiolto. Symptoms of a serious allergic reaction may include rash, hives, swelling of the face, mouth, and tongue, and breathing problems. Call your healthcare provider or get emergency medical care if you get any symptoms of a serious allergic reaction. Do not use Stiolto for treating sudden breathing problems. Always have a rescue inhaler with you to treat sudden symptoms. Do not use Stiolto more often or at higher doses than prescribed by your doctor. Do not use Stiolto with other LABAs or anticholinergics. Get emergency medical care if your breathing problems worsen quickly or if you use your rescue inhaler, but it does not relieve your breathing problems. Call your healthcare provider if breathing problems worsen over time while using Stiolto. Tell your doctor about all your medical conditions, including heart problems, high blood pressure, seizures, thyroid problems, diabetes, kidney problems, glaucoma, enlarged prostate, and problems passing urine. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, including eye drops, vitamins, and herbal supplements. Stiolto may interact with other medicines which may cause serious side effects. Stiolto can cause serious side effects, including sudden shortness of breath that may be life-threatening, fast or irregular heartbeat, increased blood pressure, chest pain, high blood sugar or low blood potassium that may cause muscle spasms or weakness or abnormal heart rhythm. If any of these happen, stop taking Stiolto and seek immediate medical help. Stiolto can cause new or worsening eye problems, including narrow-angle glaucoma, and can increase the pressure in your eyes, which can cause the following symptoms: eye pain, blurred vision, seeing halos or colored images along with red eyes. If you have any of these symptoms, stop taking your medicine and call your doctor right away. Stiolto can cause new or worsened urinary retention. Symptoms of urinary retention may include difficulty passing urine, painful urination, urinating frequently, or urinating in a weak stream or drips. If you have any of these symptoms, stop taking your medicine and call your doctor right away. Stiolto is for oral inhalation only. The Stiolto cartridge is only intended for use with the Stiolto Respimat inhaler. Do not spray Stiolto into your eyes. The most common side effects of Stiolto are runny nose, cough, and back pain. Tell your healthcare provider about any side effect that bothers you or that does not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Read the step-by-step patient instructions for use for Stiolto Respimat before you use your inhaler. Please see accompanying medication guide, instructions for use, and full prescribing information, including boxed warning. Indication for Stiolto Respimat. Stiolto Respimat, tiotropium bromide, and olodaterol inhalation spray is a prescription medicine used long-term, 2 puffs once each day, in controlling symptoms in adults with chronic obstructive pulmonary disease, COPD. COPD is a chronic lung disease that includes chronic bronchitis, emphysema, or both. Stiolto contains the anticholinergic tiotropium and the long-acting beta-2 adrenergic agonist, LABA olodaterol. Stiolto works by helping the muscles around the airways in your lungs stay relaxed to prevent symptoms such as wheezing, cough, chest tightness, and shortness of breath. Stiolto is not for treating sudden symptoms of COPD. Always have a rescue medicine with you to treat sudden symptoms. If you do not have a rescue inhaler, contact your healthcare provider to have one prescribed for you. Do not use Stiolto if you have asthma. Stiolto is approved to treat COPD only.
Living Health with COPD. Subscribe for daily video uploads. We have videos for everything COPD. From daily motivational videos, to exercise tips, health tips, diet and supplement tips, study and article reviews. Hit the notification bell so you can be notified of our daily videos. Have a blessed day and be COPD strong.